Okay, we've had a hospital aide report that a patient with a trachea is acting agitated and restless. So before entering the room, I would go to the computer, look up the medical history, see if there was any neuromuscular disorders or anatomical features that might cause airway obstruction, or any risks for airway obstruction, such as a pulmonary disease, LOL, or even fluid balance. So I'm going to look at all that stuff, and I'm going to see past sputum results and see anything that came from there. And I'm going to go ahead and enter the patient's room, knocking on the door, entering. Hi, Tom. I'm Shelby. I'm going to be your nurse today. So I'm going to go ahead and, since he's nonverbal, I'm going to check 2 identifiers on his wrist. See, his last name is Tom Brokaw, and his birthday is April 22nd, 1988, which matches the chart history, so we know that this is our patient. Now, Tom, you seem restless, and even now I'm constantly assessing him as I'm in the room. I can see his eyes are open and his breathing is labored, and his respirations are fast, and I even hear some wheezing. So Tom, I'm just going to check your heart rate and your respirations here. So try to breathe normally the best you can. After 30 seconds have elapsed, I've noticed that his respirations are about 22 per minute, and his heart rate is extremely elevated to about 100, and he should be in about the 80 level, and respirations should be about 13 to 16. So Tom, I'm going to go ahead and check your lung sounds just initially. Hearing some crackling, which indicates mucus buildup in the lungs, so we are going to have to do some suctioning. Okay, Tom, get you a fresh one of these. I'm just going to place this on your chest to cover it up from any excretions. So when I do this procedure, what we're going to do, I'm going to open your vent up for only about 10 seconds. We're going to insert a catheter to suck up some of that mucus. And during the procedure, you're going to want to cough. You're going to feel like you're going to want to cough. Go ahead and do that, because it helps us get the mucus out of your lungs, which is extremely important. So now that we've covered you up, I'm going to go ahead and hyperoxygenate him. So he's at a 2. He needs to be 100% more than that, so we're going to move him up to a 4. And we're going to check the suctioning and make sure it's on. I do feel suctioning, so that's good. Go ahead and check his pulse oximeter so we can get a baseline for what his oxygen stats are before and after the procedure. Okay, Tom, you're in about an 85%. We need you up in your 90s. So I'm going to go ahead and wash my hands. Dressing fields, I'm going to want to grab it around only 1 inch around the perimeter, because that is the side already considered contaminated. It helps keep my dressings clear. Now I'm right-handed, so I'm going to want to place a glove on my right hand and keep the other glove non-gloved, or other hand non-gloved, to remind me that it is in fact non-sterile. And it also gives you a backup glove in case one gets stuck on your hand. up some saline. Use my non-sterile hand to pour some saline into here. About 100 milliliters. We're going to check the pressure of the section. Of the saline, we're about between the 100 and 200 range, which is normal. So then I'm going to go ahead and remove his vent for no more than 2 seconds. I want you to take a deep breath. Cough for me if you can, Tom. Twisting as I pull it out. Sectioning as I go. I'm going to wait about 30 seconds and just monitor his breathing. So listen for the wheezing sounds. See if he's getting any of that fluid out of there. I'm also going to monitor the tube and make sure it's clear. Okay, I'm going to go ahead and clear it again after 30 seconds to 2 minutes has elapsed. Clear my tubing. All right, we're going to suction one more time here, Tom. I want you to go ahead and cough. If you can. Very good. I hear some fluids exiting. So at this point, I'm checking to see his breathing one more time. And I'm going to reassess his vital signs using the pulse ox. Okay, Tom, it does look like you were back up to about 92. So we don't have to do the suctioning procedure another time. Go ahead and clear all this out. And because you did cough, Tom, I'm just going to go ahead and clear out your mouth for any possible excretions left inside. Are you breathing better, Tom? And I am assessing him to note other signs of breathing better. I've noticed he has relaxed his body language. He is not as tense. His breathing does not look as labored. His eyes are back down to a normal width. It just seems like he's calm. All right, Tom, we're going to clean inside of your mouth here using the sponge swab. Just dip some water. Getting the roof of your mouth and your tongue, the sides of your cheeks, making sure those airways all get clean and the mouth gets lubricated. Okay, Tom, I'm also going to clean around your trach. Get that clean. Take a deep breath for me. I'm going from inside out, a deep circle, but I don't want to do this procedure more than 10 seconds so that he can breathe. Once that's all clean, Tom, I'm just going to assess you one last time and hear your lung sounds. So I'm looking for 10 different sounds on